Hello everyone, we are the IT specialists, and today we're going to be presenting our solution within the challenge set of telemedicine.
My name is Shervin Jafari, and I was the team leader.
I'm Nathan Lear, and I was the UI designer.
I was Jessica Nickel, and I was the project coordinator.
I'm Lily Kernick. I was the solution architect, and our final team member was Mohammed Faiz, who is unfortunately unable to join us for this recording.
So as for our problem statement, our problem is to enhance the engagement of clinicians by improving the overall inability to perform effective physical examinations virtually. So our problem targets mainly physicians, as due to COVID, resources and time are extremely limited. We'll discuss going forward how our solution will alleviate this problem.
So our solution name is Telemedicine Physical Examination Enhancement. Our solution vision is all about enhancing the physical examination methods for physicians utilizing telemedicine. Ensuring comprehensive patient details are available during a virtual examination is essential to make effective clinical decisions. Adding in specific tasks and questions related to physical examinations will improve the overall inability to perform effective physical examinations. The main focus for this solution is to improve the throat examinations.
So this is just a prototype of what this part of the application could look like. Here is the option to add a self-examination, which can be viewed by the physician or by the patient, giving patients a chance to manage their own health to an extent, and can provide a timeline of the progression of symptoms.
At the beginning of each examination, there will be a COVID self-assessment checklist, having the patient check off if they have any of these symptoms. During this pandemic and even post-pandemic, we believe that this will be a standard that will be put in place for many health organizations for a while.
And so here's where a patient can select their examination of choice. A patient can complete multiple examinations if it is required of them. But for now, we're simply going to focus on the throat examination to see what an average experience will look like.
So after selecting the throat examination, a checklist of symptoms for the patient will appear for them to complete. This checklist will help physicians gain a better understanding of the patient's symptoms, which will help with the diagnoses of the patients. And here's an example of what the checklist would look like for a patient after they complete it.
So currently, one of the limitations with telemedicine is that you lose some of the important details that a physician can capture in person. So this portion just allows the patient to take a short video of the back of their throat. However, we recognize that this might not be fully reliable on its own because of things like poor video quality. So the following slides are an attempt to compensate for this.
Next, within the throat examination, the doctor would instruct the patient to go to a mirror and examine their tongue, distinguishing different colors, spots, rashes, or other abnormal sores. From there, the patient would then select which tongue indication picture is the most representative as theirs.
Here's where a patient will indicate the color of their phlegm. This can provide a lot of important information to the doctor, such as if there is blood in the patient's saliva. The patient would simply be asked to spit into a cup or bowl and then indicate which discoloration matches the ones provided.
Capturing when the patient's first symptoms occurred within the last 48 hours is important and has been included. The patient will have to estimate using the time slots when the symptoms first appeared. Then the patient has to answer if they have eaten anything unordinary within the last 48 hours, and if so, they will have to indicate what they ate.
So typically during a face-to-face appointment, your doctor would ask some questions about your habits and your history. So this section allows the patient to record this information ahead of time.
This is the last portion of the throat examination, and this will be included within each self-examination taken within this application. It will ask questions regarding their experience, having the patient rate their experience for their current assessment that was just taken, judging on how long the appointment lasted, as well as a comment section on how their visit could be improved. We have this in place to create a cycle of ongoing continuous improvement within our telemedicine solution.
As for feasibility, this solution will be made available cross-platform for things like phones, tablets, and computers, so that a patient can use whatever it is available to them. Furthermore, it will be made available to them for free and also available in a multitude of different languages, such as English, French, and Spanish. It will also be made usable by people who have hearing/talking disabilities.
As for the summary, this solution will enhance clinician engagement. It will improve virtual examinations by making them more comprehensive. Patient engagement will be better because patients will be directly involved with their virtual examinations. And finally, patients will be able to provide feedback about their examination using this solution.